All right, everybody, we're gonna get started with the award ceremony. Anyways, before we get started with that, I wanted to let you all know that I have, in several occasions, I have spoken with Governor Cox about the peer movement and the peer support and what we're doing. I don't know if you all know, but he has an initiative, it's called One Utah, that is working on integrated healthcare and working with many communities. And I'm honored to be a part of it. But also, he wanted to send us a message today, and he recorded one for us. And I was going to share it earlier, but we were catching up. So now that we're caught up, I would like to play this message from Governor Cox to us as peers, and then after that, we're going to award the prizes.
We have some work to do when it comes to mental health. Close to 1 in 5 Utahns experiences poor mental health. Suicide was the leading cause of death among Utahns ages 10 to 24 in 2018. And Utah has the 7th highest drug overdose rate in the United States. These startling numbers have undoubtedly been exacerbated by the COVID-19 pandemic, and it has been difficult for Utah's behavioral health care system to respond to this growing need. Our rapidly growing state population will only intensify the effects of existing staffing shortages. That's why I am proud to speak in support of our local peer agencies for the important work they are doing to address this gap. Our peer specialists provide support to address mental health and substance use problems in our communities. Our peer agencies are working alongside our healthcare systems and local and state governments to advocate for systematic changes in our healthcare system. These changes advance health equity and increase access to those who need it most. Latino Behavioral Health Services was just recognized for their advocacy efforts with university neighborhood partners. LBHS received the Robert Wood Johnson Foundation's Community Campus Partnerships for Health Equity Award. This national recognition highlights the capacity of the peer-to-peer model to address the provider shortage and provide culturally and linguistically responsive services in a highly impactful and cost-effective way. Peer-to-peer services work by centering the voice and leadership of those most impacted. You, the Utah residents who have experience with mental illness and substance use recovery. Partnerships between the Utah Division of Substance Abuse and mental health and other peer organizations like LBHS are driving the development of a strong peer workforce that can help to get the needs of all people in Utah met. Peer agencies are collaborating with this growing peer workforce on the ground to provide behavioral health care services to some of our most underserved populations. Thanks to the peer movement, hundreds of Utahns who might otherwise have difficulty accessing care are able to connect with someone who has the lived experience to support them in overcoming their substance use and mental health challenges and begin the process of healing and recovery. I want to express my gratitude for the work you are all doing and my deepest wishes of success in your efforts to improve the well-being of those you serve.
So every year at the Utah Peer Conference, we have been given the Jacqueline Gomez Arias Peer of the Year Award. This year, we added 2 additional awards. So we are going to award the Peer of the Year Jacqueline Gomez Arias Award, also the Family Peer Support, the Changemaker Award, and the Making It Happen Youth Peer Support Award. So we're excited about that. And without further ado, I am going to I'm not going to say much because I want to give the time to them to say a few words and to thank or to acknowledge and let us know about their work, what you're doing, what does it mean to you to be a peer and all of that. So we're going to start with the Peer of the Year, Jacqueline Gomez Arias, and I'm going to invite Teresa to hand it over to the winner. And the winner is Misty Boozenny.
Wow, I'm gonna try not to cry. Wow, I'm so honored to receive this nomination of Peer of the Year. I have worked so hard in the past 8 years being in recovery, just being a good person, being a peer in recovery. Today I work with Wasatch Behavioral Health in Utah County. I'm a peer on the MCOT team, and I just love being a peer. Being a peer is super beneficial to our peers that we serve in our community, and thank you to all those that nominated me.
Thank you for everything you do, Misty. Well deserved. Congratulations. All right, so we are gonna move on to the Family Peer Support Award, the Change Maker Award. So I'm gonna invite Robin up here to hand it over. And the winner is Amanda Duran.
Thank you, Teresa, Jacqueline. I have struggles in my home with my kids or my daughter. Same for every single family, have the little issues or big issues in family, and I didn't know where I can find help. So I find Jacqueline, and Jacqueline say, "Come in, we listen to you." And I was looking for one door, two doors, every single door. Help me, and nobody listened, or nobody believed. It's for the youths, it's for the teenagers issues. You are exaggerating, but she listened to me, and I started the high fidelity wraparound process for my own family, and that works. And I say, okay, if this works for me, works for another families. And as I'm here, I'm working 10 years for the Latino community, support the families, the parents, and guide them and work together with the hand, work and find the resources, find the help, find the solutions or treatment. And that's why I'm here. And thank you, Latino Behavioral. Thank you, everybody.
Amanda's a rock star. For everyone that knows Amanda, you know how great she is and how much she's given to the community. Okay, so some say the last but not least, we're gonna award the Youth Peer Support of the Year. It's called the Making It Happen Support. I'm gonna invite Lisa here to hand it over. And the winner is Choi.
All right, so I just wanna get emotional because I cry a lot. But I just want to say I am so happy that I was able to meet Latino Behavioral Health Services. I was kind of lost in my career of what to do. I know I wanted to help people, but I didn't know how or where or when. And I was also going through my own sort of recovery with depression and anxiety. And so it was really hard for me to have hope. But then I found a family in Latino Behavioral Health Services. All the green shirts over there and over to the sides. the people that made this conference happen. They are truly my family. I was able to grow with them. I remember my first interview with Leticia Frias, and I was just in shock of the amount of work that they were doing and the amount of, like, I guess, stairs I had to climb, because I was like, I'm no one right here. And then as I was given opportunities, as I was able to grow and help other people grow, it's so beautiful to be able to give back when we are given so much. And I am truly grateful for the opportunity to serve my community, to give those in recovery a place to be, a place to know that they can and will be able to help others. Sometimes when we are in that place, in that dark place, we think there's no way out. There's no one will accept us, no one will take us in. But our stories are what makes us strong. Our stories are what makes us beautiful. And that is the wonderful thing about being a peer, is using our own stories to heal other people. So thank you very much.
It's hard not to get emotional, right, when you hear people and the impact that they're making in the community and that they make on us as well. It just makes you reflect about those who lost, those who we lost in the last year or two, since we last saw each other in person. And then I want to paraphrase some of the words that Ryan shared with us this morning, is that, what is the magic number? When is this going to be taken seriously by our government, and then finally put the resources to it that we need? But in the interim, I am so humble and happy and grateful and thankful to be a part of this community, because you guys are the ones that are saving the lives out there day in and day out. And that's all I'm going to say, so I'm going to cry. So anyways, so thank you to those that received the awards today. Amanda, Nata, Misty, very well deserved.